When you hear the word frostbite, what comes to mind? Probably some epic mountain expedition, right? But the truth is, this is a really serious injury that's just as likely to happen on a cold city street. It's a medical emergency that can affect just about anyone. So let's break down exactly what happens when the cold truly bites.
Wow. This just perfectly captures that terrifying moment when the feeling is just gone. It's that awful shift from fighting an external enemy, the cold, to realizing it has actually invaded your body, becoming a part of your own tissue. This is the very first sign that your body is making a desperate, desperate choice, sacrificing your extremities to protect your life. All right, so first up, let's get into what frostbite actually is and who's most vulnerable. And trust me, the answer isn't just who you'd expect.
So, what is frostbite, really? Well, the clinical definition is pretty straightforward. The second your tissue hits the freezing point, that's when the damage starts. It's best to think of it as a thermal injury, kind of like a burn, but instead of being caused by too much heat, it's caused by a profound lack of it. And this is where things get really surprising. Yeah, of course, mountaineers are on the list, but statistically, men between the ages of 30 and 49 are the most commonly affected group. And the risks are even broader than that. Factors like homelessness, having poor circulation, smoking, drinking alcohol, or even something as simple as wearing boots that are just a little too tight, all of these can put anyone in serious danger. Okay, so we know who's at risk, but now let's zoom in, like way in, down to the microscopic level to see what is actually happening inside your body when your tissue starts to freeze. See, your body is incredibly smart, but it's also ruthless when it comes to survival. When it senses extreme cold, it makes a critical decision: protect the vital organs no matter what. And it does this by clamping down the blood vessels in your hands, your feet, your nose, and your ears, basically pulling all that warm blood back to your core. But this very survival tactic is exactly what leaves those outer areas totally vulnerable to freezing. The damage isn't just one thing. It happens in these four distinct and pretty brutal phases. First, your blood vessels constrict. Then, as the tissue actually freezes, sharp little ice crystals literally form inside and around your cells, physically shredding them. After that, your blood flow slows to a crawl and starts to form tiny little clots. And in that final phase, those clots can completely block circulation, which starves the tissue of oxygen and leads to gangrene. So with all that chaos happening on a cellular level, how can you actually tell what's going on from the outside? Well, this leads to a really critical point about diagnosis. You can't truly know how bad the injury is until after the tissue has been rewarmed. So, the big question is, once you've started rewarming, how bad is it really? Well, clinicians classify the injury into 4 degrees of severity. Okay, this chart really breaks it down for us. First degree, that's superficial. Second degree, you start to see clear blisters. But pay close attention here. If those blisters are purple or filled with blood, you are now looking at 3rd degree frostbite, a much, much deeper injury. And 4th degree, that's the most severe. The tissue is hard, it's black, it has died, affecting muscle and even bone. The type of blister is one of the clearest signs a doctor has to go on. And now we get to the really critical, practical stuff. What do you actually do? Because getting this right can absolutely mean the difference between a full recovery and permanent damage. Okay, I need you to listen very closely to this. This is the single most important rule of frostbite first aid. If you thaw frozen tissue and it has any chance of refreezing, the damage becomes exponentially worse. We're talking catastrophic. It almost guarantees tissue loss. It is far better to walk on frozen feet to find shelter than to thaw them out and let them freeze again. So let's break down the do's and the absolute don'ts. You want to rapidly rewarm the area in water, but never with dry heat from a fire or a space heater. That's just way too uncontrollable and you can easily cause burns. And please, absolutely do not rub the area with snow or your hands. Remember those sharp ice crystals we talked about? Rubbing just grinds them deeper into the tissue, causing more damage. An early dose of an anti-inflammatory like ibuprofen can also really help fight the swelling that causes even more problems down the line. So we've talked about rewarming in water, but how warm should it be? Well, the temperature is critical. The ideal range is 37 to 39 degrees Celsius. Now, if you don't have a thermometer, which you probably won't, the water should feel comfortably warm to a non-injured hand, not hot. And you should know, rewarming is often intensely painful, but it's the absolutely necessary first step toward healing. Okay, so you've made it through the immediate danger, you've started treatment. What's next? What does that long road to recovery look like? And, maybe more importantly, how do we make sure we never have to go down that road in the first place?
This right here is one of the hardest things for people to wrap their heads around when it comes to frostbite treatment. The immediate urge, of course, is to remove the damaged tissue. But doctors, they wait. Amputation is almost always delayed for weeks, sometimes even months. And why is that? It's to give the body the absolute maximum amount of time to heal itself and declare what's truly alive and what isn't.
And this timeline really shows you why that patience is so vital. After that initial rewarming, it can take weeks for a clear line, what doctors call demarcation, to form between the healthy tissue and the non-viable tissue. If a surgeon makes a decision too early, they could end up removing tissue that might have actually survived. But at the end of the day, the best treatment is just not getting frostbite to begin with. And it all comes down to some pretty simple preparation. Dress in loose layers. Stay dry. Avoid things like alcohol and tobacco that mess with your circulation. Stay fueled and hydrated. And here's a great pro tip. Mittens are always warmer than gloves because they keep your fingers together, sharing heat. So there you have it. We've walked through the science, the signs, and the solutions. That knowledge is your armor. But the final question is, will you use it to properly respect the incredible power of the cold?